Have you ever really stopped to think about what's going on inside your body when you grab that inhaler or take a pill for your allergies? It's pretty amazing stuff. Well, today we're going to pull back the curtain on these really common and sometimes totally life-saving medications. We're going to get into how they work, why a doctor prescribes them, and this is the big one, your super important part in making sure they're used safely. All right, so let's just dive right in. We're going to break down the science behind some of the most common meds for your immune system and your lungs. We'll look at the drug's class, its mechanism of action, that's how it works, and what it's primarily used for. So first up, we're going to talk about medications that basically act like referees for our own immune system. Our internal defense force is incredible, right? But sometimes it goes into overdrive, and that can cause everything from the sniffles to the much more serious situation of a body rejecting a brand new organ. And what's so fascinating is how the exact same principle, just managing the immune system, can apply to two completely different scenarios. I mean, on one hand, you have the super high-stakes world of organ transplants, and on the other, you've got the everyday battle against allergies. So let's start with that critical scenario, preventing the body from rejecting a new organ. The drug we're looking at here is called cyclosporine. It belongs to a class of drugs known as calcineurin inhibitors, and you can think of them as powerful negotiators that basically convince your immune system to play nice with the new organ. So how in the world does it do that? Well, cyclosporin works by blocking a very specific pathway in your immune cells. It's essentially sending them a message that says, hey, stand down. This is absolutely vital because without it, your body would see that new organ as a dangerous invader and just attack it nonstop. Okay, so even though cyclosporine is an absolute lifesaver, it comes with some pretty big risks. For one, it can be really tough on the kidneys. And since it's telling your immune system to take a break, it makes you way more likely to get sick. Oh, and that thing you've heard about grapefruit juice? It is 100% true. Seriously, no myths here. The stuff in grapefruit can actually mess with how your body breaks down the drug, and that can lead to some seriously dangerous levels building up in your system. All right, next up, let's look at what I like to call the Swiss Army knife of medications, glucocorticoids. You might know one called prednisone. These are really powerful anti-inflammatories, and they're used for a huge range of things, from helping prevent organ rejection to keeping chronic asthma under control. Their main job is to put a lid on inflammation and just dial down the intensity of your body's immune response. And that's exactly why they're so good at reducing the airway swelling you see in asthma and COPD. It's also why they're often used right alongside drugs like cyclosporine after a transplant. And this brings up a really key point about medication safety. You can never just stop taking these drugs cold turkey. The dose has to be tapered down slowly to let your body get used to it. Oh, and if you're using an inhaler version, a simple rinse of your mouth after every single use is absolutely essential to prevent a fungal infection called thrush. Now let's switch gears to a medication a lot of us have probably taken, antihistamines. The biggest difference between the older first-generation drugs and the newer second-generation ones really just boils down to one simple thing: drowsiness. See, the newer drugs are designed to be way more selective, so they hit the histamine receptors causing your allergies without crossing over into the brain and making you all sleepy. Okay, so we've covered the immune system. Now let's shift our focus over to the lungs. In this next part, we're going to explore the medications that help keep our airways open, giving people with conditions like asthma and COPD that literal breath of fresh air. When we talk about inhalers, there is one difference that is absolutely 100% critical to understand: the difference between a rescuer and a maintainer. The rescuer is for right now, for immediate relief when an asthma attack is happening. The maintainer is for every day, for long-term control to stop those attacks from happening in the first place. Albuterol is the classic rescue inhaler for a reason. It's a short-acting beta-2 agonist, or SABA, which is just a fancy way of saying it targets specific receptors in your lungs to quickly relax the muscles wrapped around your airways. And that gives you that immediate relief when you're really struggling to breathe. But here's the thing: even the best rescue inhaler in the world is useless if you don't use it the right way. Following these 4 steps is so important to make sure the medicine actually gets deep into your lungs where it needs to be. So remember, a good shake, breathe all the way out, a slow, deep breath in as you press, and then hold it for 10 seconds. That's the secret sauce to getting the most out of every single puff. Now, inhalers aren't the only tool in the toolbox here. There are also oral medications like theophylline, which helps to relax those airway muscles, and montelukast, which actually blocks the specific inflammatory chemicals that can trigger an asthma attack. So these just offer different ways to get that long-term control. And this brings us right back to how important it is for patients to be aware of what's going on. With a drug like theophylline, something as common as smoking can seriously cut down its effectiveness. So it's vital for doctors to know if a patient's habits change. And with montelukast, there's a rare but very serious potential for mood changes. It's just a big reminder that we have to pay attention to both the physical and the mental effects of our medications. So, to wrap things up, I want to look at a case study that just perfectly shows how critical the how of giving a medication can be. This is a situation where one simple mistake can have truly devastating consequences. We are talking about a drug called promethazine. And while it's technically an antihistamine, it carries what's called a black box warning. That's the most serious kind you can get. And this warning has nothing to do with the drug itself, but everything to do with how it's given. So listen, this is not your average run-of-the-mill list of side effects. No way. The warning here is incredibly stark. It says that if this drug is given the wrong way, it can cause such severe tissue damage that we're talking about gangrene, we're talking about needing an amputation. I mean, that is the absolute worst-case scenario. And the crazy part is, it's completely preventable. This is such a powerful reminder that for some medications, the route you give it is every bit as important as the dose. The super strict rules for giving promethazine, like preferring a deep muscle injection and absolutely avoiding giving it under the skin, they're all there for one reason: to protect the patient from terrible, devastating harm. So from the food you eat to the way you take a breath, we've seen how all these small details can have a massive impact on whether a medication is safe and effective. So the next time you open a pill bottle or reach for that inhaler, just take a second to appreciate the incredible science that's at work and your vital role in making it all work for you. Thanks for watching.